Now, as I had mentioned in the intro, today we're going to be continuing with our series of discussions revolving around this COVID-19 pandemic. And according to a research that was done by World Vision, it is said that, some of the secondary effects that are going to be arising from this pandemic, post the pandemic, are going to affect children the most. But why is this so? That is a discussion that we want to have right now. And joining us right now, we have with us Lilian Dodzo, who is the National Director of World Vision here in Kenya. Welcome, Lilian. Glad you made time for us this morning.
Thank you. Good morning.
Good morning. Now, let's just get straight into it. Now, according to this research that was done by World Vision, it estimated about 30 million children being at risk of secondary effects from COVID-19. Tell us a bit about the background to this research that was done.
Thank you very much for this opportunity to talk about children's issues in relation to pandemics. The research that was done is called Aftershocks. And it was released on the 8th of April 2020 by World Vision International. It is informed by our experience with the Ebola pandemic, which devastated countries in West Africa, such as Sierra Leone, Liberia, Guinea. And World Vision was at the forefront of that response to the Ebola crisis. And what we observed when we were responding was that much as children during the Ebola crisis were not that much affected by being infected, and there were low death rates for children, what was evident was some secondary, if you like, hidden impacts that were also occurring on children, some of which were related to lack of access to immunization, because pandemics such as Ebola, as is the case with COVID-19, can cause a lot of pressure, especially on weak health systems.
Now, still looking at, coming back to this research, it is said that, from this pandemic of COVID-19, children are going to be affected more with the side effects, the secondary effects, as opposed to COVID-19 itself. Why is this the situation?
This is so because, again, drawing on our Ebola experience, when you have overburdened health systems, it means that some of the primary health that are normally provided by health systems, such as vaccinations, such as treating diseases like diarrhea, pneumonia, that affect children, will not get that focus that normally would be given by healthcare systems. So you find that children continue to suffer from those diseases. It could also be because of fear by caregivers to take them to those health services. So children will be dying from those preventable diseases that normally would be treated. And then also with the guidelines that have been given as well, restrictions on movements, lockdowns, there's also an increase as well in areas related to child protection. You find that there's an increase in sexual violence on children. There's increase as well in some of these negative cultural practices that are now happening because of children being out of school, like child marriage, like FGM, as well as child labor, as children are sent out to also meet the needs of families that are under a lot of economic stress right now.
All right. I would like for us to look at some of those areas that are said to be going to be affecting our children the most. And let's just start by looking at these other deadly diseases that are sort of being overlooked during this time. From the research that, was conducted, what are some of these deadly diseases that are going to pose potential high risks to our children post the COVID-19 pandemic?
Diseases such as malaria, diseases such as pneumonia, and then some such diseases, malnutrition as well. Because, as these restrictions are happening, quite a number of households have also lost their income. And that causes a problem of food insecurity. And with food insecurity, there's a rise in malnutrition in children. So if children are not getting the attention that they deserve through these healthcare systems, because the focus is on COVID-19, we could see an increase in deaths from malnutrition, an increase in deaths from preventable diseases like pneumonia, as well as malaria and other such diseases.
So how then do we try to ensure that the progress that has been made so far is not really thrown off the tracks when it comes to dealing with some of these deadly diseases that have always been affecting our children the most?
What we need to make sure is ensure that as we communicate prevention messaging around COVID-19, we also focus on child protection messaging to make sure that parents and caregivers are aware that they need to make sure that children stay safe at home, and also ensuring that healthcare systems make provision for other activities such as immunization to continue, even if they set aside areas in healthcare systems where mothers and caregivers are able to continue to bring children for such services. It's important that that is done. And then also communicating to caregivers that they should not be healthcare centers, especially if separate areas which are risk-free or where risk is mitigated are set up for them, then that should be communicated to caregivers so that they know that they are able to take children to healthcare centers so that all these other activities like immunization, like vaccines can continue. And we can also implement other activities like communicating, broadcasting using different media like radios. I know that in Osiligi, for example, World
All right, we are getting right back into that conversation with Lilian Dodzo over there. Remember, we are talking about the secondary effects that are said going to be very harsh on our children post the COVID-19 pandemic, and we're just trying to look at some of those factors that were highlighted from this research that was done by World Vision. Of course, pegging on the previous pandemics that have hit the world. Classic example was during the COVID-19, the Ebola pandemic, apologies for that hit the world, and the consequences were felt most by our children. Now, getting back to the conversation, Lilian, another area that you have mentioned that is going to really affect our children is when it comes to food security and nutrition. Now, looking at the fact that so many schools have been closed across the world, and you find that there are millions of children, approximately about 310 million children who actually relied on school meals to just get through the day. What now happens to these children who school was their source of nutrition?
Yes, that's another source of concern, because that also could be one high cause of malnutrition. Because you know, as you said, that a lot of children are benefiting from these school feeding programs. And for some, that was the only source of a nutritious meal that they were getting in a day. So what we are promoting as World Vision, and I know that other stakeholders, including government, are doing the same, is to make sure that we identify and register all those vulnerable families that could be food insecure and implement cash transfers to them to give them that capacity to be able to purchase food at household level and to provide for the children's nutritional status.
All right. Now, looking at some long-term solutions that can be put in place for some of these children to ensure, even when we are having such pandemics, even in future, that, you know, the source of food and nutrition is not as compromised as it is right now. What are some of those long-term solutions that you think the international community could come together and put in place for our children?
Long-term solutions would be to really focus at how of families by ensuring that we really strengthen their economic capacity. Resilience building programs that help families to have access to income. You know, World Vision, we implement some long-term development projects like savings group, what we call savings for transformation, which encourage families to be able to have access to services that help them to make at family level, and other income generating income power. Those are some of the things that international organizations and organizations such as World Vision could do to really make sure that long-term economic security at household level.
All right, now let's quickly move on to another aspect that was also heavily highlighted as a consequence from this pandemic, and this is the health system. Now, a fact that has come to broad light is that, you know, COVID-19 has brought out the realities of our health systems, and not just here in Kenya or in Africa, but the world as a whole. Looking at how compromised our health care systems are, paint a picture for us, you know, from what you did from this research. What was the image that you got from looking at the compromised healthcare systems?
The image we got from the Ebola experience was that our health systems are quite weak. And like I said earlier, when a pandemic such as COVID-19 comes on, that further overburdens the already weak health systems. So what is important is for our governments to know that there's a need to really focus on health systems strengthening, because without strong health systems, it's very difficult to be effectively responsive to pandemics such as Ebola, as well as to pandemics such as COVID-19. And this is what renders children vulnerable, because once resources are focused on addressing the pandemic, other much needed primary and tertiary care becomes neglected. And this is when we see devastating secondary impacts on children, where they become affected by all sorts of other preventable diseases that can end up increasing the death rates of children that could have been avoided.
And also still looking at the healthcare system, there has been a noted increase in the number of maternal and neonatal mortality due to some of these directives and, measures that are being put in place by our governments to just try and flatten this curve of infection. How then do we factor in, mothers who are in marginalized areas, who are losing their children and consequently their lives because they're not able to get to medical facilities due to the curfews that have been put in place?
Where we have to really make sure that our community-based resources are activated and we heighten monitoring. By community-based resources, I'm referring to people or utilizing resources like assistant chiefs, making sure that our area advisory councils are meeting regularly and keeping track and monitoring all those marginalized families and vulnerable families that need to have access to protection and access to services. Also making sure that our children protection officers as well are also working and monitoring on a daily basis and providing reports through their counties, and these reports also escalated to national level so that appropriate action can be taken to make sure that vulnerable children have access, are protected, have access to health services, and that if they're going through any cases of child protection issues, that those are also addressed. So monitoring, heightening monitoring, and also giving access or permission to children officers to also be considered as essential services, because right now I believe that they are not, and yet they could play quite a critical role at community level in helping to monitor and report some of those cases to local authorities.
And speaking of child protection, systems, there has been a noted increase in the number of, sexual offences cases that have been reported just here in Kenya. It is said to have gone up by 30% in the month of March alone. And this has also consequently been as a result of the unavailability of safe houses due to crowding. Now, for children who are in environments where, they are not safe, they are being defiled, they are facing all this gender-based violence, and of course, it is the ripe season from some of these cultural practices. How then do we best protect them during this time and just help lessen the impact that they're going to feel post the pandemic?
We have to use our community-based mechanisms to identify those children and register them. And I know that we can also put in place what we call foster care families that can take care of children that are either abandoned right now or alone because either their caregivers are isolated or in quarantine. We need to make sure that we follow up, monitor and register all those children, and foster care is provided for them. There are programs that can be put in place by organizations such as ourselves in partnership with county governments, with county commissioners and area advisory councils to make sure that those vulnerable children have foster care. And then we can also have case workers that can also be supervising and making random visits to those foster families to make sure that the children are taken of well. And then, like I said earlier on, cash transfers can also be introduced to make sure that those families that take on children that may be left alone are also provided with resources to ensure that they can also take care of those children through those cash transfers.
All right, and what about children who are in extreme situations where they may not have, not surrounded by adults or a neighborhood that is that accommodative, and they're facing so much discrimination and stigmatization as a result of being in the care, under the care of caregivers who might be taking advantage of them? How then do we increase awareness levels to reach these children, to let them know that there are avenues through which they can be able to get help?
use broadcasting through radios. And like I said earlier on, World Vision is using an innovation where we are actually sending out vehicles to communities using loudspeakers to reach all the remote villages to make sure that people are informed on some of the child protection issues and mechanisms that are available to them, as well as popularizing the child helpline, the government's child helpline 116, which people should know that is available for them to call and report any suspected cases of child protection issues. So popularizing those numbers, 116, and also popularizing toll-free number 1195, and then using some of these simple mechanisms like radios, like loudspeakers and APs going from village to village to make sure that people are informed are some of the simple ways that we can make sure that that message is relayed. And then even in the daily updates, for those that have access to television and radios, daily updates that are given by government, we should make sure that child protection updates are also given in those daily updates. They have a wide reach nationally to make sure that people know what they need to do to make sure that children that are staying at home are safe and protected, and the hotlines that they need to call when they have any suspected cases.
So how then do we now bring in the local governments down at the county levels to just make sure that they are at the forefront when it comes to championing for all rights and all other efforts that involve protecting our children, especially, and shielding them from some of these effects? The role of the county government.
The key thing that the county governments could do is the county commissioners making sure that the area advisory councils are playing their role, meeting virtually as we respect social distancing, to make sure they receive daily updates from those community mechanisms that are in place. Because area advisory councils can have a reach at county level, at sub-county level, and they can also make sure that they receive that information in those reports and document all that information, escalate it to the counties, and also escalated to the national level so that the Ministry of Labor and Social Protection is also informed of what is happening around child protection issues. So activating all those key mechanisms that exist already at county level is important.
All right, now, as we draw the conversation to a close, maybe you could tell us a bit about the World Vision response plan that is being put in place to just ensure that the secondary effects of COVID-19 are not as harsh as they are expected to be on our children.
Is actually activating our child protection mechanisms at community level to make sure that we work with area advisory councils, we work with assistant chiefs, and we also work with government child protection officers to make sure that cases are reported, they're identified, and we're also popularizing information about the helplines that need to be utilized event that there are child protection issues that are identified. We are also working to ensure that we relay messaging around child protection issues, not only around COVID-19, washing hands, social distancing, but also laying emphasis on child protection to make sure that as children stay at home, caregivers make sure that children are safe, children are protected, and if they find any suspected cases, we also give them information to know where they should report it. So that's some of the activities that we are doing. We are also working with key stakeholders to make sure that those child protection mechanisms that normally exist at county level continue to be functional. We're engaging with county commissioners, county governments to make sure that they continue to be functional, and also working with other partners to make sure that we implement cash transfers to those vulnerable communities that have had their economic livelihoods negatively impacted by COVID-19 or by the restrictions that have been imposed, so that they continue to provide nutritious meals for their children, and children have good state of nutrition as they go through this difficult period.
And maybe your message to some of the adults out there who are in a direct contradiction of some of these measures that we are being told to observe, issues like social distancing, putting on a mask, avoiding going out unnecessarily, and still coming back to environments where children are and putting them at risk.
My message would be we need to all be responsible. Listen to being provided to us by WHO and by our national government, because we all have a responsibility not only for ourselves, but for each other. And if we continue to be irresponsible, we are not only putting ourselves at risk, but also others at risk. So it's everybody's responsibility to follow the guidelines, to make sure that we wash our hands constantly, we wear masks, and we stay at home. We only go out when we absolutely need to, but stay at home as much as we can. That is the only way that we can slow down the spread of this infection and we can get back to our normal lives.
All right. Thank you so much. That is Lilian Dodzo, just in our Women at the Forefront segment. She is the National Director of World Vision here in Kenya, sharing more insight in regards to this research that was done by World Vision, which clearly indicated that children are at the highest risk from suffering the secondary effects of COVID-19. And ultimately, these include other deadly diseases, issues to do with malnutrition, a compromise healthcare, and of course basic necessities. And of course these are issues that we need to start looking into right now before we get to a situation where 30 million children are going to be exposed to the secondary effects of COVID-19 as opposed to COVID-19 itself. So these are conversations that we are going to be continuing. These are conversations we will be having more and more here on Good Morning Kenya to help you better understand why it is important to follow these directives that we are being given to ensure that post this pandemic, it is not a chaotic situation, and most especially for our children. That is that for that segment, but do stay with us. We have more of Good Morning Kenya coming up, and of course, there is a helpline for children who are in vulnerable situations and may not have access to adults or caregivers who might be in a position to help them. So if you know a child who is in a situation where they are being abused, they're not being taken care of, you can always use the helpline 116 to get assistance down to these children. Or if you are that child, you can always call that number, that is 116, to be able to get the assistance that you need as a child or as a caregiver to protect these children during this time. Now we take a break, but we'll be right back with more of Good Morning Kenya. Do keep talking to us using the hashtag Good Morning Kenya. See you after the break.